Is there anything you can do to maintain your brain health as you age? Scientists say the answer is yes. So let's look at 13 factors that can affect your brain health. I'm Lee Kelso from the HealthCall Live Radio Hour. Thanks for joining us. Next to cancer, Alzheimer's and dementia is the condition that Americans fear most, and with good reason. There is a financial time bomb in our future as the cost of caring for all of us baby boomers with dementia looms untold. So we're going to learn more about what those factors are and how you can keep your brain healthy through your life by talking with Dr. Ronald Lazar from the University of Alabama at Birmingham. Doctor, thank you for joining us.
Lee, thank you for having me today.
So what can I do to help keep my brain healthy and active?
I think the first things to understand is that it is better to protect having a problem than having a problem that you have to treat. And so we are thinking about looking at proactive things that all of us can do to protect our brain. And this is just not an activity that we engage in later in life. It's a lifelong process, beginning when we're kids and then all the way up through older age.
Now, I've always heard that what is good for your heart is good for your brain. Does that still hold?
That is still correct, but we've expanded that to a couple of other things, but fundamentally that is still true.
So let's start down the list of the 13 different factors, things that we need to take a look at. Tops on the list is one that many people are probably already aware of, but tell me about the importance of controlling blood pressure as it applies to brain health.
Blood pressure is one of the most important factors that we need to control, and it is readily treatable. We do know, for example, through studies that tighter control of blood pressure does reduce the risk of cognitive decline and dementia. So the blood pressure guidelines from the American Heart Association are that we keep our systolic blood pressure. We have two values, one over another, systolic and diastolic, but try to keep the systolic blood pressure at least close to 120 as possible.
What's the connection? How is high blood pressure damaging my brain?
Because the elevated blood pressure puts stress on the blood vessels within the brain. And so they build up cholesterol and plaque, and they become stiffer. And so we're less able to have the cerebral blood flow through the brain that allows it to function as healthy as possible. It also results in the accumulation of certain kinds of changes within the brain around the blood vessels in certain parts of the brain. And that is also associated with cognitive decline and dementia.
You mentioned controlling cholesterol is important. Tell me more about how that affects my brain. My brain is predominantly made of fat. Cholesterol is a type of fat. It seems like those two would go together.
Well, we need some degree of cholesterol for our brain to function properly, but too much cholesterol can build up inside the arteries of our blood vessels, and it reduces the blood flow to the brain. And it also seems to be important in reduction of inflammation, which is also critical to keeping our brain healthy.
And then another big factor that everybody around my part of the world is concerned about, and that is blood sugar levels as it relates to type 2 diabetes and pre-diabetic syndrome or pre-metabolic syndrome. So tell me more about the importance of blood sugar in relation to brain health.
So the inability to metabolize all the sugar that we're supposed to because we've accumulated too much actually has two kinds of bad effects for the brain. One is that it promotes the formation of proteins in the brain and inability to metabolize them properly, and that is a risk factor for Alzheimer's disease. And it also affects the blood vessels in the brain so that the vascular properties of the brain are also affected, and the result is that you have reduced blood flow, and that also impacts cognition.
So keeping blood pressure under control, obviously critical for many different reasons. Let's move ahead now to exercise. So again, we're talking about what's good for the heart is good for the brain. Is it just a matter of keeping blood flowing through the brain? Is there something else that exercise does to help us keep a healthy brain?
So exercise is probably one of the best things that we can do. And in fact, exercise affects the other 12 factors in many important kinds of ways. So what exercise does, it increases blood flow to the brain, as you've just stated, but it also brings certain kinds of chemicals into the brain from the body, which is also protective. And so it really is it's probably the single best thing that we can do from a behavioral standpoint to maintain our brain health.
Does it matter whether I'm doing strength training or cardio? Does it really matter, or just movement and blood flow is what's most important?
It is a matter of engaging in about 150 minutes per week of exercise that increases your heart rate. But we also know that doing resistance training also produces certain factors in the brain as a result of changes in the systemic circulation, as a result of what happens in metabolism. So it's good for both of those reasons.
So really, we're talking just a little over 20 minutes a day is all you need of some type of activity that elevates your heart rate.
That's correct. So the requirements, as people think about it, is at least 3 days a week of 50 minutes. But if you did 20 minutes per day, that's probably even better.
And I'm thinking here of my audience who's really not into exercise and kind of says, yeah, I know I should. Does just a simple walk around the block, does that count?
It does help, but it's not as good as doing something that raises your heart rate to the extent that you're physically able to do that. And you should work with your physician to make sure that you know what your individual tolerance is for raising your heart rate. But once given that kind of guidance, the closer you work to that, the better it's going to be.
Tell me about the role that diet plays in keeping my brain healthy. Are we talking about eating certain brain foods, or is it just a matter of keeping our general health positive?
So it actually is both protecting the brain from things that you should not have and putting things in your brain that you should have. So there are certain kinds of things like omega-3 fatty acids, which are very good for brain function. But on the other hand, fried food is not. And these factors, of course, are not independent of each other. So when you eat bad foods, you increase your cholesterol, you put plaque inside your arteries. You create a challenge for the brain to clear out certain aspects of sugar, which are not being metabolized properly. So it's both protecting the brain from a positive point of view for good things and avoiding bad things.
So you mentioned the omega-3s. They're commonly referred to as, given in the diet as fish oil, eating fatty fish, salmon, that type of thing. Are supplements important if we can't get enough in diet, and are they effective?
That's a great question, Lee. And the fact of the matter is there's very little data coming from studies in which supplements are examined, and they're not under the purview of the FDA. And I'm not saying that everything we should have consume necessarily has to be scrutinized to the same extent that a new drug, but anything we put into our bodies has the potential of having an impact, either good or bad. So there are supplements that are put forth on television, and I've read the literature, and they have absolutely no impact whatsoever in studies that have been done. So in general, the closer you can keep to your normal diet, the better it's generally going to be, unless you have a depletion because of some medical reason. But if not, a healthy diet is the best way of maintaining your brain as opposed to taking supplements.
And then body weight is listed as an important factor as well. Sounds like that's just an accumulation of all the other issues that we've talked about. Is there something specific about body weight that affects the brain?
Not really. It's really the food that we're accumulating. There are some neurochemicals that seem to be produced which are not helpful to the brain, or in certain ways are detrimental to the brain as a result of obesity. But it's more than anything else a marker of the other things you do, just as you've said.
Yeah, so the fact that certain forms of body fat are highly hormonally active and it leads to inflammation, that's where you're thinking those are the factors of obesity that are counterintuitive for a healthy brain?
Yes, and actually, Lee, you bring up a very good point, and that is the impact of inflammation. That is what we're trying to avoid more than anything else, because it's inflammation that really hurts the brain the most and is also the basis for the development of atherosclerosis. So to the extent we can minimize inflammation in our bodies systemically, the better our brain is going to be.
We talked before about the concept of inflammaging, so inflammation tied to aging. Are you a subscriber to that theory?
So as we get older, there is increased amounts of inflammation that takes place as a natural part of the aging process. But what we're thinking about here is that the things we can do to mitigate that process, to reduce it as low as possible. Those things like diet and exercise are really important, and that minimizes the amount of inflammation we're going to have. So there are studies ongoing, for example, Lee, that are looking at individuals who are successful agers, and we're trying to learn from them what it is that they do to help maintain their brain function and reduce inflammation.
Smoking status, I think, is on the list here. I think that's pretty obvious, so we're going to walk past that one. Just don't smoke, right? I mean, what can you say? Just don't smoke.
Please don't.
Yeah, exactly. This is real interesting, though. The next item on this list, depression and social isolation. I would not have link that up with brain health. Tell me how that works.
Well, there is a very strong interaction, for example, between cognition and depression. And so when we are socially isolated, it leads to other kinds of behaviors. It also increases stress. Stress causes inflammation. Depression is also associated with inflammation to some extent. And depression also impacts our ability to take care of our health in the ways we've been talking about already. So it has both a biological as well as behavioral impact on how well our brain is doing.
Oh, I get it. So if I'm depressed, I don't care as much about health. I don't take care of myself as well. There's that impact. Is there something about the neurochemistry of depression that also affects cognition?
Yes, there is an interaction there. There are parts of the neurochemical system which do interact with memory, for example. And so treating depression can actually improve our memory when we think that the depression is a major causal factor here. There's an entity known as the dementia of depression. And so when successfully treated, the cognition of these individuals definitely improves, in part because they are now more functional with regard to the way they interact with society, but it also decreases these brain chemicals, which are also deleterious.
We'll move on now to alcohol use. My gosh, don't tell me that I have to give up a glass of wine or two after dinner.
Well, I haven't yet either, so we're in the same boat as far as that's concerned. So the data seem to suggest, and it's still a bit controversial, that a small amount of wine each night actually is beneficial, especially red wine, because of resveratrol, and it seems to have impact on some inflammatory factors. So the data are more in favor of saying that wine is good. Some people are not as convinced, but it's a small amount. When you exceed that, that's when the brain is going to have a problem.
Yeah, I think we understand the connection with alcohol and what it does to the brain. So let's move ahead to sleep and the importance of good sleep. This is a problem for many, many people.
Sleep is really important. When I have patients come into the office, we routinely ask when we're doing a cognitive examination, how is your sleep? And we know clearly when people are sleep deprived, their cognition becomes impaired. But what we've also learned recently, that during sleep, the brain is much more active than we previously appreciated. And so, for example, there are certain chemicals in the brain, certain proteins in the brain, when accumulated in too high a level, can actually lead to something like Alzheimer's disease. And what sleep does is actually clear these chemicals out. So it has both an effect of washing the brain to some extent, as well as allowing us to function as alertly as possible during the course of our waking hours.
And time is slipping by us, but I want you very quickly to touch on hearing loss and how that affects our brain health.
So it's begun to be believed more strongly that of course, lack of hearing creates social isolation, and we talked about that before. But it's also believed that there's a sensory deprivation as a result of hearing loss, and that is not good for the brain either, especially as we get older. And it's true not only of hearing, it's probably true of vision as well. So it turns out that hearing loss is undertreated in this country, and what I think we're trying to advocate in primary care is that we should pay attention to hearing and get it evaluated. It's a very simple, non-invasive thing to do. And if more people had their hearing treated, it would reduce to some extent the amount of cognitive impairment that we're seeing in clinical practice.
Well, I have much more to ask you about, but time has gotten away from us. Thank you very much. That's Dr. Ronald Lazar. He is with the McKnight Brain Institute at the University of Alabama at Birmingham School of Medicine. I appreciate your time.
Thank you very much for having me again.